I flagged it last night, but it's back with a vengeance today with the decision announcement by Daniel Andrews that the so-called trial at the North Richmond injecting room will now be made permanent. Have a listen.
What the review shows us is that there's been more than 6,000 overdose events within that injecting facility, and the modelling indicates that 63 deaths have been prevented because of the work of the North Richmond supervised injecting facility. This is changing lives and saving lives.
Now, today in the press conference, a lot of questions the Premier didn't answer. The sham of consultation with affected locals, the lack of rehab, mental health services, not just to give people a place to go and buy drugs and use drugs, but actually get them off illegal drugs, and the reality of some of those overdose statistics. Joining me now, Victorian Shadow Minister for Health, Georgie Crozier. Georgie, the duplicity, I'm not surprised. This is Daniel Andrews after all. I know a lot of locals out there are incredibly angry at the way this has been handled. I'll get to them in a moment. But some of the statistics there from the Premier, this idea that they were consulted, this idea that they've saved all of these lives, give us a bit of a reality check.
Well, Peter, you're right. This review that's been undertaken by Mr Ryan and others, 25 pages, I might add, that's taken years to do. It hasn't just gone to the heart of those 6,000 overdoses that the Premier claims. What did that mean? Because in the criteria, it means oxygen, an oxygen level of 95% could be an overdose, somebody being saved from an overdose. So we don't know how many of these users in the clients in the injecting room have actually had naloxone or Narcan reversal for their overdoses. We haven't got the breakdown of heroin users and ice users. We haven't got the breakdown of just what is actually happening and how many of these clients that are using this facility are actually getting off these heinous drugs as well. So there's a lot of data that we don't know about, and there was certainly some issues around the review that weren't even canvassed. And one of those, of course, was the suitability of the location, and the location being next to a primary school, which we think is just the wrong spot for this injecting room to be.
We know with the King's Cross facility, it's not near a school, it's not near low-income people that are living in a housing commission. I mean, it's right up against housing commission homes in Victoria. But we also know, I think most importantly, people in Sydney use the facility and there are wraparound services in it. In Victoria, we're told, a lot of people just go to the vicinity, buy their drugs, but don't necessarily use the injecting room. And even then, there's no attempt in that injecting room with wraparound services and rehab to get people off drugs. Why not?
Well, that's exactly right. Why not? What is happening to these people that are using these drugs? And what we do know, Peter, is that since the injecting room has been located next to this North Richmond area, next to a school, that the numbers of syringes in the area have gone up by threefold. So 18,000 syringes a month are being collected. They were around 6,000 a month prior to the injecting room. So that's telling you that there's a lot of use outside the injecting room, that they're not actually using these drugs inside the facility if they're dealing and using outside in the streets. And so, again, we just don't see exactly the true recovery or rehabilitation or support services that you speak about that you want these people to have. How many of these users have actually got off the drugs? We don't know those. We don't see that data in this report. We don't see how many people have actually been supported and rehabilitated properly and got off heroin or ice.
I'm just about out of time. Just quickly, Georgie, do we find out anything today about another injecting room for the CBD?
Well, what we did hear from the Premier today, interestingly, Peter, was he confirmed that a second site had been purchased for a second injecting room, but he was waiting on the lay report. Now, we've been calling on the release of that lay report for months. It's well overdue. So it's clear that the government had intentions to have a second injecting room. They bought the Uralla building in Flinders Street for $40 million. It's sitting there idle. That's been sitting there for months. This is very concerning for those businesses, for those residents in the city. And let's understand, if he's got concerns about the location in the city, why hasn't he got concerns for the location of the North
All right.
Richmond residents.
Got to leave it there, Georgia Crozier. Thank you. I'd have to say $40 million. How you put some homeless people in that building and not the drug addict problem brought into the CBD?